Hello, everyone. Welcome to another episode of the ACE podcast. Today, I'm joined by Mr. Paul Molina. Paul is a very experienced exercise physiologist, and he's here today to talk to us about the history of Swiss ball training in Australia. Paul, thanks for joining us.
Thanks, Luke. How are you?
I'm really, really well, and I'm super excited to be talking to you today. Paul, I guess we might start with a little bit of a background as to your experience as an exercise physiologist over the last, would we say, 20 years, perhaps a little bit of a brief overview of your journey and where you are today.
Yeah, thanks, Luke. I thank you for thinking that I'm that young. But anyway, I've been doing exercise rehab and exercise physiology through different modalities pretty much since 1993. So it's probably more now 31 years. And originally started off purely and utterly working with physiotherapists and creating our own clinic doing exercise rehab, mainly for sports performance and high level athletes, but then noticed that things needed to come around to looking at the workers' comp world and just general populations as well. As I progressed through that sort of scenario, I owned a couple of rehab gyms here and there and had clinics within physio circles, but also got sort of headhunted to start going off and doing some lecturing and presentations around the world with regard to high performance exercise and exercise rehabilitation for those high performance people. And then also started doing some stuff with regard to the workers' compensation um, group of people as well. Probably around 2000, decided to move down from Sydney down into the Illawarra area. And at that point, that's when I really started heavily getting into the workers' compensation aspect of the world. And basically started to branch out more from just the treatment side of things and started to doing a lot of occupational rehab. I was general manager for about 13 years of a rehabilitation company, looking after all of their injury management teams, looking after all of their pre-employments and medical assessment teams, and at the same time, still keeping my finger in the pie with regard to high-level sports performance and exercise rehab as well. And just finally have now moved into a specialty insurer looking after coal miners. Again, more in, I suppose, the managerial aspects of things, but everything comes around full circle and you basically are sitting there making decisions and looking at, um, you know, what's happening with an injury, how are they recovering, what's actually going forward. And so the EP aspect of life always comes up in every conversation that you have. So I suppose that's probably a really quick summary of what I've done in the EP world since in the last 31 years.
Certainly sounds like your background is strong in the musculoskeletal neurological condition department. Would that be fair? It sounds with your background working with the physiotherapist initially on and then staying in the workers' compass field, I guess it sounds as though.
Yeah, definitely. Yeah, definitely. That's probably the main focus has been musculoskeletal. I did do a little dabbling. I was part of the initial group that was asked to comment on what was used to be called phase 3 cardiac rehabilitation back in the very early days under St Vincent's Hospital and Dr. Victor Chang's wife at the time, who was leading that cause. And there was a few of us who were just asked to throw our 10 cents worth in. But I must say the majority of my stuff has been, 100% musculoskeletal.
And I must mention that you are my fellow student colleague in a particular Masters of Strength and Conditioning that was also part of your background and your bio.
Yeah, 100%, mate. We did do our masters together, and we did a groundbreaking project on lawn bowlers from memory, where we basically everyone else was picking high level sports, so we picked high level lawn bowls to model our processes for exercise prescription and I suppose problem solving with regards to that particular cohort. So yes, it was quite an entertaining um, period of life. Yes, I must say.
And I still have copies of that assignment. So after this podcast, if you want to reminisce, I'd be happy to send them your
Thanks.
way, believe it or not.
Yeah, thanks, mate. Thanks. That'd be nice.
So, Paul, throughout your career journey, I guess parallel to being an EP and setting up clinics, working in clinics, working in works, you also dabbled in presenting course course writing, I should say, as well as presenting. And you briefly alluded to that in your introduction. I'd like to explore that a little bit more because I guess that's the focus of this conversation today, is to talk about the Swiss ball. Can you get me started on how that all eventuated and what paths you took to get involved with the course development, writing, and then presenting those particular workshops?
Yeah, I suppose it was trying to think, getting my memory to work. I think it was around the late 90s, maybe early 2000s. Was originally approached through the fitness industry, to be quite honest. There was a professor that was, he was an exercise scientist. This was before the term exercise physiology actually became a term and people were registered as exercise physiologists. He came to me, he was working in a hospital, and he was saying, look, we need qualified people to help us drive content, because what we could see happening was more and more doctors and allied health professionals were starting to refer out to these exercise scientists to try and assist people in their rehabilitation. On top of that, they also started referring to what was then a very booming fitness industry. So you had a large number of people who would go off and do their Cert 3 and 4 in fitness, but back then Cert 3 and 4 didn't exist either. But basically wanted to make sure that there was a line in the sand with what fitness industry professionals could do. There was a line in the sand with what exercise scientists could do. And so the main impetus behind it all was looking at exercise prescription. And generally it started off with just general gym-based exercise prescription, and making sure that what the personal trainers, what the exercise scientists was doing was safe, and what they were doing was in concert or in consultation with the allied health professionals or the medical teams that may be involved in these scenarios. From there, we moved into Swiss ball training. And the reason behind the Swiss ball training was nothing really fit the model about what we wanted to do with the specific population that we were dealing with, who was quite degenerated, or also were quite restricted as to what they were able to functionally do in an exercise program. So we were starting to receive rehab programs from the medical teams where people had 2, 3, and 5 kilo lifting restrictions. They had predominantly low back injuries. They weren't allowed to squat. They weren't allowed to bend. They weren't allowed to twist. But what they wanted them to do was increase their core stability. So this was prior to the groundbreaking paper from Queensland University on core stability and the access of the transverse abdominis. So we started looking at what other avenues or what other tools could we use to create an overload requirement for an injured person, but also stick to the actual restrictions. And that's sort of where the Swiss ball came in. We started looking at the Swiss ball as a tool that we could overload somebody without actually necessarily physically loading them.
Yeah, that's just so interesting, and it brings back so many memories. And look, I have to ask this, Paul, and for some listeners of our vintage, they might remember a certain Swiss ball celebrity who used to like squatting on the Swiss ball with a barbell on his back and doing other feats of impressive performance. I have to ask what influence that certain individual, Mr. Paul Check, might have had on your, I guess, venture into this world of Swiss ball training.
Well, look, Paul Check was a very interesting character. He definitely did take things to extreme. But having said that, when you look at the cohort of people that he was training people who were extreme athletes. So we're talking about X-game athletes. They were things like skateboarders and people on motocross bikes and those sort of things. So really needed a high balance quotient. I suppose what Paul Check did, and what was probably, he was the first person to do it, is he looked at a lot of the rehab evidence. He also looked at the high level sports performance evidence, and he put it together. And what he basically did is he put it together in more of a continuum, rather than saying, this is just rehab, it stops here. This is now sports performance, it starts here. So he basically put it into a system as a continuum. A lot of his stuff was extremely high level, but that's because that's the cohort he was dealing with. He was only really dealing with high level athletes. Didn't do that much with the completely degenerated person. But the way he structured his research analysis and the way he basically then turned that into exercise prescription um, is a model that's pretty much still working today. It's not necessarily just attributed to him. He basically borrowed from a lot of the heavyweights back in the day, so people like Charles Poliquin and those sort of guys out in the United States and in Canada, and basically cherry picked the best out of all of their research and combined it into one.
Yeah. Yeah, I think it's an excellent overview and summary. So tell me a little bit about your initial intentions with the Swiss ball in terms of what you hoped participants who'd go to those courses would get out of it. So you've mentioned briefly that you wanted to help create that scope of practice, understanding and respect. How do you think the Swiss ball worked well to try and keep those health professionals at the time quarantined into their boundaries, their scope of practice boundaries? And what else were you hoping to get out of delivering that course, if you can remember?
Yeah, I suppose there was two main things with it. What happened is the Swiss ball just started showing up more and more in gyms. So that was number one. And like any new tool, kettlebells is another example afterwards. As soon as the Swiss ball started hitting the gyms, all the personal trainers, all the gym attendees just wanted to use it. So a lot of the impetus of basically coming up with a program and writing a program for this, which was definitely assisted by one of the manufacturers of Swiss balls in Australia, was to basically provide guidelines so that the exercise prescription was safe for the individuals who were actually participating in. The other reason was that it was a time in the world of exercise rehab and in rehab in general where core stability was the buzzword at the time. Everybody was looking at core stability. We were looking at the physiotherapy-based model, which was basically extremely micro and extremely low level as far as what they wanted to do. Whereas when we looked at the sports performance model of athletes and just general population, there was such a large step between that low-level physio-based rehab and the higher level stuff that people were doing day to day in the gym and what they were doing for sports performance. So we needed a tool to try and bridge that gap. And the Swiss ball at the time was one of those tools because it was able to add an aspect of instability. So instability equaling nervous system and muscle recruitment, and rather than just necessarily adding load. So by just adding the Swiss ball into some of these exercise programs, we were able to create an environment where we were overloading those two systems without actually providing strain to those two systems. And that's sort of where it came into the fold.
Yeah, that's perfect. And I would add to that, it's been validated on, I guess, not long after Richardson, Hodges, and Hyde. They were the research group from Queensland, particularly Hodges,
Yep.
physiotherapy group. Stuart McGill, Professor Stuart McGill, author of the book Lower Back Disorders, he came out and really spoke about the Swiss ball and what it does and what it doesn't do. And he certainly made some strong points around it being a progression from floor-based exercise, which completely validates your approach and your model, that getting on a Swiss ball is a progression from lying on the floor and doing your core exercises on a floor, for example. Get on a Swiss ball and you double the compression to the spine, for example.
Yeah.
And that's
yeah.
well documented in his textbooks. And I was lucky enough to be at the World Congress of Lower Back Pain conference many, many years ago in Melbourne when he presented and first, I guess, challenged a lot of these concepts that that research group in Queensland had presented.
Yeah, exactly. And you've got to remember that, to be quite honest, exercise rehabilitation is very, very young as far as a speciality. It is something that may have been going on anecdotally through physios, through other interested parties, and also through high-level sports coaches as well. They obviously need to tailor their exercise programs for their athletes. But as I said, there was never really a progressive link from rehab to high-level sports performance. And it was often relied upon by just the individual exercise scientist or the individual coach to make that progression and hope for the best that they were doing the right thing. And that's where I think that was one of the main reasons why we started to look at this a little bit more globally, because also when you look at the research, that's what was happening. It was very much siloed as rehab or sports performance, and there was nothing linking the two. There needed to be something that would link or even just rehab to general population exercise programs. We needed something that would link it and provide an environment for progressions.
Yeah, it's a beautiful summary, really. And I guess I have to now ask how far have we come since then, those days, those early days, and where we are now, and what you've seen. I should say 30 years. Apologies, in terms
Yep.
of now that we've become a profession in our own right. Uh, have you seen any improvement in that regard in terms of that link between acute rehabilitation and chronic rehabilitation?
Yeah, definitely there has been. There's been, apart from a lot of research in the area, there's been a lot more mature application by the exercise physiologists and the exercise scientists moving forward. So what I mean by that is we've gone away from this is the only way you can rehab somebody doing X and Y. So let's say they're recovering from knee rehab. Let's say they're recovering from a low back condition. We're basically looking at things more holistically. We're looking at things such as a Swiss ball or any other piece of gym equipment or any other piece of exercise equipment as a tool in the toolbox, all right? And we're now actually applying those tools more appropriately to basically match the circumstance of what we've got. So we're not just giving anybody and everybody a Swiss ball exercise because somebody said this is a good tool for rehab. We're actually looking at it being really critical, and we're choosing the right tool to get the right outcome. And I think that is something that is very much been very, very important in this field. And we've gone away from that really cookie cutter approach where everybody goes in and basically gets exactly the same program. I do remember when probably in the 2000s, I was rehabbing an individual who was a rugby league player. I was also rehabbing an individual who was a competitive basketballer. They were basically managed by the same strength and conditioning coach. Their strength program was identical. Okay, so
Uh-huh.
the football player and the basketball player had an identical strength program. That I hope, and I do believe, does not happen anymore. We are creating strength programs that matches um, the biomechanical requirements of the athlete for the actual sport that they're doing. And I think that is much, much better. And it'll continue to improve. It'll continue to become more and more finite as we go further and further into our research.
Yeah, yeah, very encouraging feedback and thoughts there, Paul. So I guess that's a nice segue into, I guess, talking about where the Swiss ball might fit in today. Now that we've evolved our methodologies and understanding of that gap between acute and chronic rehab has improved and changed. Practices have changed. Here we've got this tool that I still believe sits in many studios and gyms, whether it's an EP studio or an exercise science based studio or a gymnasium, all these different settings that ESSA professionals work in. I dare say there's probably still a Swiss ball somewhere close by. Yet I
Yeah.
wonder how many of our ESSA professionals are using the tool to its full capacity. So I guess what value do you see the Swiss ball playing in this process?
Yeah, I think there's several. So it does have absolutely perfect applications if you're ever dealing with anyone with any sort of vestibular-based issues or concerns. It definitely has a role for those people with any sort of balance type issues and concerns, whether they're brought on by disease, injury, or just age-based processes. But I still think it has a role with regard to that link between rehab and progression into higher level performance. And what it does do is that generally what we do is we look at when we're progressing someone, we look at several aspects of a rehab of a program to progress. So one of those aspects may be load, one of those aspects may be repetitions, one of those aspects is to change the rest work ratios. But basically, they're pretty blunt instruments as far as what we're doing to try and to progress someone. And when you do have an individual who is a little bit stuck in their rehab as far as their progression is concerned, um, putting in exercises that basically involve instability, such as exercises on the Swiss ball, does basically challenge the nervous system without actually changing those other parameters, i.e. load, sets and reps and work ratios. So it is a tool that can often take somebody being stuck in a rehab program and actually progress them. because what you're doing is unconsciously is you're challenging the nervous system while they're doing something that they can normally do. Okay, and that basically does set up the nervous system for change. So if you look at a lot of the research that basically connects pain to dysfunction, you can have somebody who has originally had pathology but no longer has it, but still exhibit pain symptoms that are exactly the same as when their pathology was very acute. Okay, when you speak to the neuro professionals about this sort of pain that they're exhibiting, what they often come back to you, even what they often describe, is that the nervous system has become hyperactive. That consider that this pain presentation is normal presentation, and it's almost like a fear-based response. So the best way it was ever described to me by a neuro professor was basically, imagine you're in a really you're in your normal neighborhood at home, you know everybody, and somebody taps you on the shoulder. You automatically turn around and say, hey, how you going? Because you expect it to be somebody you know. But if you were in a really, really dodgy part of town, you didn't know anybody, it was dark, there were strange noises, and somebody would tap you on the shoulder, you would automatically tense up and start to feel fearful. That's what they're describing as the nervous system's reaction to somebody who has chronic pain, right, and is exhibiting that chronic pain. So what the Swiss ball can do without being overt, without being deliberate, and without actually dealing with the person's cognition is to provide that environment where they're doing something that they're safe and they're comfortable with, but they provide an environment that challenges the nervous system without being overt about it. So it's a little bit sneaky, but it's one of those things that we can use to try and break that pain function barrier. Does it work for everyone? No. As I said before, it's a tool, and it will work for some people.
Yeah, it's such an elegant answer. And I think I've been taking some notes there. I really, really have taken some notes there because I just love the explanation or the linkage back to chronic pain because so many of our EP professionals are dealing with chronic pain. And I dare say there was a lot of perils of wisdom coming from your many years working in the workers' compensation scheme and field where no doubt chronic pain barriers present as a major limitation to a return to work. So I get the
Yeah,
sense this is
it's
something you might have come across.
Yeah, it's interesting. I mean, if you look at strictly in New South Wales in particular, and you look at the guidelines that come from CIRA in particular, they basically say pain is not a barrier for return to work.
Yep.
That's easy to put in a document. It's very difficult to explain that to an injured worker who, let's say in my current instance, has to return to a coal mine where they're lifting ridiculous amount of weights, doing a lot of stuff underground with other men around very large equipment. And if something happens, it takes them 2 hours to get them out again. Yeah, that argument is quite moot. So you really need to address the aspect of pain. Otherwise, you end up with people who never progress.
Yeah. Yeah, that's wonderful. And even more interesting, the concept that the Swiss ball could augment an existing exercise, just add that novel stimuli that could potentially, not for everyone, as you said, we have to accept that but it's not the panacea. No tool is. That's important to recognize and not be biased with that. But the fact is that it can absolutely work as that novel stimuli to augment an existing exercise and just provide that stimulation to the nervous system, almost that potentiation, you could say, in some
Yes.
respects, that then just helps them overcome that potential adaptation barrier they're facing where you don't want to add load. And like you said, you don't have time to add volume. Adding load provokes pain, and then you haven't got time to add volume. So where do you go, sort of thing?
Exactly, and I think that's it. If you look at the Swiss ball training historically, when we first started doing it, yeah, we probably did market it as a panacea for pretty much anything and everything, and that was very naive. But that's what happens with these sort of things. It's like when you start looking at any sort of research at all, you can sort of factor that into research into pain meds, and you can research into other medications or other supplements and those sort of things. They all start off as being the be all and end all for everything. But then as research becomes more sophisticated, as more and more members of the population and studies are completed and get exposed to this, we refine that research and refine the application of that particular tool and make it more and more finite to something that is actually useful and doable. So you may have a Swiss ball in your gym and not use it for 6 months. That's fine, but it's there. It's a tool. It's something that you want to be able to have as one of those applications that you can basically apply if nothing else is working. And will it work for everyone? Agreed with you, 100% no. But it is something that you can basically apply in a relatively safe environment as long as you follow um, the general principles of making sure that you're not putting your clients or your workers or your participants at risk. It is something that you can look at. It is definitely not something that you just basically say, all right, Wednesday is going to be Swiss ball day. Let's see how we go. Let's see how wonderful you can do front squats on a Swiss ball with 20 kilos on the bar. Not going to work.
Yeah, totally. Paul, one of the novel things that you did was you created a sequence rather than just throwing together a lot of exercises, which is a common approach with a tool. Just get a tool and then catalog, 100 different exercises that you can do in it. Your approach was to create a sequence, and I will test your memory if you don't mind, and
Oh,
ask
yes.
you if you could. I thought that was very novel, but also a very unique way to present a tool.
Yeah.
Can you talk me through how did you come up with the idea to create a sequence rather than just teaching 100 different exercises?
Yeah, so what we looked at is we looked at the basic, what we classified as biomotor requirements for every human being, right? So if you look at it at the moment, there's a trend out there to basically say, is there a certain level that you need to be able to, or a certain function you need to be able to reach as, for instance, like myself, as an over 50-year-old person, right? So should I be able to squat? How many reps can I do, et cetera, et cetera. So back in the day, this was, again, very relatively in its infancy. We were looking at the basic motor patterns that we considered were essential for people to basically do their day-to-day activities and then also to exceed or succeed in sport. Okay, so we looked at things such as squats and lunges. We looked at lying supine, lying on the side. We looked at rotation as one of those. We looked at side bending. We looked at extension and flexion. We basically, pushing and pulling. We basically then went through the catalogue of exercises and came up with a group of exercises that were relatively general as far as intensity was concerned. And we basically identified an exercise for each one of those biomotor levels. Once we had achieved that, we then looked at what would be an easier way to do that. So we came to exercises that were much less intense as far as that was concerned, that we could classify as beginner exercises. And then we went the other way and said, how do we advance these exercises and make them more difficult? So the rationale behind it was to look at somebody a little bit more holistically and make sure that they could do all of those movements. It was definitely around the time where, for instance, ergonomic assessments went from you must have perfect posture, you must be sitting ridiculously bolt upright, to something more dynamic. So it was basically assisting people to make sure that there weren't really, I suppose, gaps in their ability to move in all directions and in all functions. So that's how we sort of structured the program, rather than saying Swiss balls are great, here are 200 exercises, go for it.
Yeah, absolutely, absolutely, and it still stands out today as being a very unique approach to using that particular tool. On the other side, then, what advice might you have for EPs on what not to do with the Swiss ball, and some important boundaries do you think EP should be aware of if they start to think about using the Swiss ball more in their practices? And an exercise scientist, I should add as well.
Yeah, definitely. Swiss balls are by nature unstable apparatus. It installs an unstable environment. As I said before, it might be good, it may be appropriate, and it is appropriate for your people who are challenged vestibularly, if that's a word. But what it also does is there's definitely a fine line between challenging someone and going too far, right? And that's where I think the issue comes in with these sort of Swiss ball training, with training in general. It's like anything. It's like getting somebody to squat. As an example, if I'm doing a squatting program, when I was in my 30s and 40s, there was no real limit as to how much I would physically squat do a back squat with, except for my own probably physical ability. Now, in my later 50s, I still squat maybe to my physical ability, but I'd increase the reps, but I keep my load at a ceiling, all right? Just basically because I feel that that is safer because the risk reward ratio isn't there. And that's what you need to assess when you're doing things on a Swiss ball. What reward or what sort of result am I trying to get out of it? But there are inherent risks in using the Swiss ball. So you need to weigh up that risk reward for each one of your participants. Okay, so doing things like, as we mentioned before, squatting on a Swiss ball with a bar and 20 kilos, what is that actually giving you? And is the reward that you're going to get from that, or is the result that you're going to get from that worth the risk? Because remember, if you're falling off a 65 centimeter Swiss ball onto the ground, which is usually concrete, with a bar and something else, what is that risk? Okay, and that's what we're dealing every single day. Exercise does basically impact wear and tear on the body. It may be micro, it may happen over many, many years, but we assess that risk when we give somebody a program because we're identifying what they need to basically achieve. One professor that I used to deal with many, many years ago talked about this concept of a U-shaped relationship to exercise. And what he basically said is, if you do too little exercise, it's bad for you. If you do too much exercise, it's bad for you. You've got to find that bottom part of the U where it's actually the right amount of exercise for you. Um, that is an individual proposition. So for everybody, it's a little bit different. So that's what you need to do with the application of Swiss balls. All right. We need to basically look at what's actually happening with the individual doing the exercise. The last point I'll make on that is, let's say you are able to identify an exercise that's appropriate for somebody on a Swiss ball, and they're doing that particular exercise. Their technique and their form is 100% your guide as to when they're fatiguing. So as soon as you're seeing that they're unable to retain their form, as soon as you see that they're struggling with their balance whilst doing that particular exercise, the exercise is only over. Because what's happened is that risk reward ratio has switched much more over to risk as opposed to reward.
I'm sure a lot of ESSA professionals who are listening to this might be thinking, well, where would I start with the Swiss ball? If you could provide one piece of advice on the safest place to start on the Swiss ball, or maybe the safest position, where would it be?
I
I know
think you
that's
got,
very context
yeah,
dependent, but just if you could try and narrow it down, and if we're dealing with some vulnerable populations that could benefit from using the Swiss ball to improve their balance, for example, had never used a Swiss ball before, what position do I put them in to start with?
I forgot, probably you got two, and it's going to be dependent again on your individual. Um, number one may be lying with your legs up on the Swiss ball.
Yep.
Okay. Obviously, that's dependent. You may not be able to get your patient down into a lying position. All right. So getting him up and down, say for instance, lying supine with your legs up on the ball and just basically moving with the ball and seeing how that works may not be appropriate. The other option is to just literally have them sit on the ball and to move around with them. Obviously, what that means is initially you may need to hold on to them. Initially, you may need to give them a support, such as a stick or similar, to basically make sure that they're comfortable. But as simple as just sitting on the ball and weight shifting your body weight from left to right or from forward to back is usually where we used to start. I did a rehab program many, many years ago with an individual police officer. He was in his late 30s at the time. He was recovering from multiple surgeries, one of which was spinal surgery. And our initial assessment on him was to do a 6-minute walk test. Now, this individual basically covered 7 meters in that 6 minutes, which was how deconditioned he was. He was basically walking with the aid of his wife and myself. The very first exercise we got him to do, once we actually got him doing some sit stands and basically getting more comfortable with the ambulation, was literally just to sit on the ball, nothing else, no movement, no lifting legs, no moving arms or anything, just to sit on the ball for 10 seconds at a time. All right. And we just basically tried to slowly but surely wake up his nervous system. So the whole point of that was I was there, I was hanging on to him, I was making sure that he wasn't at risk, but we basically started at a level that was in line with his functional capacity.
Yeah,
Right.
that's just
And
a wonderful case scenario.
yeah, he did return to work eventually,
Right.
and then retired, but he did basically get where he needed to be. But I suppose the biggest trick in all exercise prescription and in rehab, doesn't matter whether you're using a ball or not, is to find out where your start point is. Once you find out where your start point is, you can progress it from there. But yeah, for most circumstances, for me, the start point was either sitting. Lying was not an option from him. He would not be able to get down to lie on the ground unless I actually got him down there myself and actually picked him up myself.
Yep. Yep. And that's a very important comment, whether or not, which position do you start with? And of course, that'll be so dependent on the person in front of you. And we always treat the person in front of us first. But just great to know, though, that such a complex case scenario where the application of the Swiss ball might be effective. And I'm sure, and as we all would agree, that wasn't the sole reason this person returned to work, but it certainly seems like it provided an important jump start to his rehabilitation process and an environment or a novel stimulation for the nervous system to start to adapt to. So,
yeah, exactly. It was just one of those applications that we applied, and we moved on. And Swiss ball came in and out of that program. It wasn't something that was a fixture all the way through. It came in and out of that program as was required at the time. Another one, as I was thinking, as far as a starting point, maybe standing with your back against the Swiss ball and the Swiss ball against the wall. And again, just that weight shifting. It's just basically challenging the nervous system to move out of the equilibrium a little bit and then come back again. Right? Very, very simple, very, very basic movements, but it's just that aspect of finding what's going to work for your individual cohort when you're training them at the time.
any thoughts about using this, performing heavier lifts on the Swiss ball? Let's dumbbell presses, seated or lying. So I still observe that those exercises take place. People, around the traps and general public.
Again, yeah.
What are your thoughts on using the Swiss ball in combination with, say, heavy dumbbells?
Yeah, one of our favorite exercises back in the day for high level sports performance people was a one-handed dumbbell press whilst lying on a Swiss ball, so like a bench press, but one-handed, so you really arced up the stability. I think the thing that answers that question is how confident are you in the structural integrity of that ball when I've got a athlete, for instance, who weighs 100 kilos. We may have a 30, 40, 50 kilo dumbbell on top of that. And what is the structural integrity of that ball? Even if we take away the neuromuscular integrity of the athlete, if we take away that, what is the structural integrity of the ball? Now, there were a lot of balls at the time marketed as anti-burst. There were also a lot of court cases in the United States, in particular, because they're very litigious, where people use balls for that exact reason and that exact exercise, and the ball failed, i.e., it burst. And the individual landed on the ground and basically had multiple injuries because it was not just him, it was him plus a load. And he was somewhere within that movement of the load. Again, I don't know what extra value putting him on a Swiss ball, doing heavy weights. There's definitely a room to give somebody a one-handed dumbbell press on a Swiss ball, but I wouldn't necessarily be doing it with 50, 60 kilos. It is something that you would do to basically stimulate the exercise, the nervous system, sorry. But if I am doing an exercise program where my goal is to improve somebody's strength, then I give him strength exercises. I will go to a normal bench press. I will go to a normal back squat. I'd go to a normal deadlift if I was doing like a powerlifting type module. And that's where I would stick to it. So again, it is not the panacea for everything. It's a tool. we do not use it to basically increase significantly the risk to our athletes.
Yeah. Yeah, no, it's perfectly placed and said, Paul. I completely agree. Well, it's been a really nice conversation, nice to reminisce. Hopefully, people listening to this might re-look at the Swiss ball that potentially is gathering dust in the back corner of their gym or studio and reimagine its purpose and potentially reconsider its use. Is there any future directions or developments you see for the Swiss ball or any instability device? Do you see any potential
Oh look,
opportunities or
yeah,
progress?
I feel like any sort of device, as I said, it as we get more and more educated and as we go further and further down the track as to what we can use these tools for, I feel there's a need now to go back and revisit some of that research, to revisit some of those exercises, and now look at it with a better lens to basically say, look, out of these 30 exercises that are in this program, those 10 or 15 are probably not appropriate. We need to move and basically refine it. So I feel that that's where it needs to come in, and it'll only come through research and experience and use. That you refine these sort of things. It's the same when you deal with any sort of profession, when you deal with any sort of cohort of individual. If you speak to somebody experienced and you ask them to say, how did you know to choose this thing over that thing? In most circumstances, they can't explain except say, I just know because of experience. What research does is it helps to give those people who don't have necessarily all that experience or the luxury of trial and error a bit of a leg up as to where to go at the very beginning with all of these sort of tools and these aspects. I think that's what's needed in the world with regard to instability training and Swiss balls. One, take it away from the gimmick and bring it back to what is its therapeutic use in both rehab and in performance. When should I be using it? When should I just ignore it and let it gather dust in the corner? And I think that just needs to be revisited.
Perfectly said. Well, Paul, thanks for your time today. Thanks for coming on the ACE podcast. Look forward to catching up with you soon. And I hope everyone listening got as much out of that conversation as I did.
Thanks, Luke.